The idea of this course is to make an introduction to medical imaging modalities, and particularly the ones that are being used in clinical practice. So I am Bart Beenens, and I'm an ICREA researcher, currently at EDBAPS predominantly, and I have a group on computational cardiology, where we try to predominantly use images, use modeling, together with clinical information. Nowadays also use more and more machine learning in order to try to investigate cardiovascular problems very close to the clinic. That's always the idea. And what you will see is that in cardiology, but of course in many other medical specialties, imaging is very, very important. Where traditionally, of course, radiology is a department where a lot of imaging is being done, but what you see nowadays is that many of the specialties actually also have their own imaging. Most of what I will be saying is nicely explained in this book from Paul Sutens on Fundamentals of Medical Imaging, which should be available in the library. So there, and many of the slides are also, or information on the slides is actually coming from this book. It's quite an okay book for this. You can find a lot of material online on imaging. Also, there's quite some tutorials on YouTube. However, take care that you get them from proper sources, because I've noticed that sometimes, especially when it's about, for example, magnetic resonance imaging that we will see in one of the classes, it's not always entirely correct. So make sure that you double check different sources and not just look at one source. Now, first of all, very, very briefly on the format of this course. Of course, this year it's a little bit different. I don't know how it's going to go online. Let's see. If you have some feedback, let me know. One of the things that many people have been saying in the past that is a bit kind of challenging in some ways is the fact that I planned this as 3-hour sessions. We will do several breaks. Let's see how it works online. Presential, it works reasonably well. And the reason for this, the reason why I do it like this, is that actually this gives the opportunity to cover in each class one of the imaging modalities. So there's about 3 hours, well, of course, with the breaks needed in order to cover one imaging modality. Splitting this, I think, to me personally, I think is a worse idea. Plus, of course, also additionally, I have a busy agenda, so it's easier to plan in some ways. But the main reason really is that we try to cover one imaging modality each time. So today I will give an introduction on the different imaging modalities, and we already cover one, which would be X-ray imaging. And then you will see which are the different ones that we have to cover in some ways. Traditionally, what I would do for the exam is that this would be an oral exam with written preparation, so that I would give you a couple of questions, mostly 3 questions, very often involving images that you can prepare first, and then you come one by one and discuss this with me. We will see how this works online. I've been doing this partially with a repeat exam last summer. That worked reasonably well, but we will see, because of course now there's many more participants. So in principle, that will be the format. Of course, everything will depend on the situation then, and I will inform you later on also how it will be done. But the main thing of this course is that I want you to be able to look at images and tell me what you see in images. I don't want you to make diagnosis based on images, of course, because you're not studying medicine and you're not becoming radiologists. But what you will see is that what is very important in medical images is that when you look at the images, you can recognize features which are specific for different modalities. And I want you to reason about these images. Even if you don't recognize what's shown anatomically on these images, you need to be able to explain me why something is white or something is black, for example, or why you see boundaries of organs or not, or something like that. But this will become clear later on. So besides that, we have also the practica and seminars. One will be where we try to make an ultrasound simulator. So ultrasound will be one of the imaging modalities, and You will have to program a simulator for this because, well, first of all, this helps you in understanding the modality better. And secondly, simulators of imaging modalities are very important, actually, both in the development of ultrasound or of in general imaging equipment, but which is also nowadays, especially when you start to do machine learning or something like that, you need ground truth data, and for that also very often simulators are being used. The other part will be based on image reconstruction, predominantly from computer tomography, where you will see that in general, most of the imaging modalities actually have some way of reconstruction, and especially this type of reconstruction is very, very important to really understand because it's relevant for computer tomography, but it's also relevant, as you will see later on, for nuclear medicine. So these are the things. This is more or less how the grading will be. One of the things is that you have to pass each part. So that means that you have to take part in the seminars and practica, unless, of course, there's some force majeure. But in principle, this is the way. And also, if you do not pass the exam, if you pass the other parts, you will not pass the subject. So that's quite important to keep in mind. Okay. So what I will start with is a brief introduction of what medical imaging is, some features which are important, and some examples of applications, just to give you a little bit look and feel of what we're talking about. And these things are very important, especially this introduction, because one of the things that you will see is that we have several different imaging modalities at our disposal. You will see that there are different ones, and all of them are being used in clinical practice. All of them are different, and they have different information. So the reason why we have these different imaging modalities is actually because not one of them will provide all the answers that will be asked for about a patient. What you will see very often, and what you sometimes also read in literature, is that some people would claim that a certain machine can actually do everything which clinically is required. But as we will see during this course, this actually is not really the case. It might be that a certain machine can assess most things, but it always has drawbacks. And so for that, we actually have to go back to why do we need imaging? Why do we need imaging modalities? What information do we want to get from it? Well, traditionally, and that is where, for example, X-ray imaging has been developed for in the beginning, is that we want to look at anatomy. And so we want to look inside the body in a non or as least invasive way possible. So that means that we would like to see the morphology at the organ level. So we want to see, for example, if there's a broken bone, if there's a tumor, if there's a change in the size or shape of a certain organ. So that's the traditional way of looking at it. But actually, what we also want to go is, of course, we want to go over. Ideally, you would go to the cellular level, because what we know is that the cellular properties, the tissue properties itself is, of course, very important in diseases, or, for example, in what they say, like congenital diseases, which means that they like have a genetic basis and you get them from birth. So some people are born with changes in their genes, which means that there's changes in tissues, even changes in shapes and changes in the organs. As you know, some people are, for example, born with all the organs like left-right switched, for example, or some organs missing, or some organs duplicated, or things like that. So this is traditionally what you want to look at the organ level, but many of these abnormalities or genetic modification also have repercussions on the cellular level. However, you can already imagine that when you want to look at the whole body at different sizes, so where you want to look at the whole body, you want to look at the whole organ up to the cellular level, these are enormous changes in magnitude of sizes. And for that, for example, some of the things like resolution is very, very important. And you will see that actually the imaging modalities, although we can get great images, they are actually not that great if you, for example, compare it with the regular cameras that we have now in our phones. But we'll come back to that later. So, but besides the morphology, which is still like a large part of what is being used, what you will see now more and more is that actually we try to find ways to image or assess the function of organs or of the body. And when we talk about function, there's different things. So first is the physiological function. For example, when you look at a heart has to pump blood, so at a certain volume, at a certain pressure. So that might be the physiological function, or it might be, for example, if you want to see if the spine of a person is properly flexible or things like that. So these are physiological function ways. But one of the other things is, of course, our whole body is one big biochemistry reactor, and the biochemical processes, the metabolism is, of course, something which is very, very important. And so ideally, we would also find ways to try to assess this, right? Because if there's disease, then very often that's something that goes wrong. Another thing that is also very, very important is that actually everything in our body is linked by the fact that it needs oxygen, that it needs nutrition. So that means that assessing blood flow, whether it's assessing the vessels, the vascular tree, or assessing is what we would say perfusion, which means is how much blood is going to a certain organ at a certain time, that is actually very, very important. That's very often also kind of ignored in some ways by some people, but you will see that an organ can never be isolated because it has to have proper perfusion, of course, in order to function properly. And so you will see that many of the imaging modalities also are actually related to trying to assess how much blood or how much oxygen is going to a certain organ. So this is what we would like to see. And so ideally we would find this, and ideally we would look at this, we would visualize this. So that's the traditional medical imaging, where you show like a radiograph, whether it's on film or on the screen, you show the image and you do a visual interpretation. Still, most of the images in the clinic are visually interpreted. So visualization is very important. One of the things that you also see is that nowadays we get very complex information from many of these scanners. So visualization might actually be a challenge also, because it becomes huge data sets and we have to find better or clever ways to analyze this data. But besides visualization, what you see more and more is important, and that's especially for follow-up or for assessing the kind of severity of disease or changes, is that we need to quantify images. Quantification can be, again, at these different levels. So it could be that we want to quantify, for example, the size of the liver for somebody with liver disease, but it could be also that we have to try to quantify somehow tissue properties which are related to cellular properties. So that means mostly that we have to quantify appearance of images, not only kind of the shapes that we see on the images or sizes, but really appearances. And of course, when we talk about function, then we need to be able to quantify it, especially if we will do follow-up of patients during therapy, for example, or over the years to look at worsening of some conditions. We need to be able to compare measurements in order to look at the effect of these things, of course. So in order to be able to do this visualization and quantification of the different things that we want to see, so obviously we need good images. So image quality itself is something which is very important. Now, image quality is partially related to what we see on the images. And as we will, or as will become clear, when we discuss the different imaging modalities, each modality shows something different. So it shows some features of some of the things that we want to look at. And so quality is defined within the setting, of course, of a certain image. Or certain modality, let's say it that way. And image quality is, of course, obviously related to the fact whether we can see what we want to do, yes, or want to see yes or no. One of the things that you have to keep in mind is that, as I said before, medical imaging modalities are far from what we are now starting to get used to with cameras. So you will see that the quality itself can be sometimes disappointing, but this is what it is. And as we will see, this is very much related to the physics and the technology of it. If you have a question, you will have to put on the speaker. Right? You can interrupt me at any moment, but I can't see the chat.
I do have a question. I don't really understand the difference between spatial resolution and image quality.
Yeah, image quality, well, let's come back first to the resolutions. So spatial resolution is actually what is the smallest thing you can see potentially. So that's often related to pixel size, but not only pixel size, as we will see also it's related to smoothing. Temporal resolution is, of course, how fast we can image some events, and that can be important. For example, when we look at a broken bone, we don't need a lot of temporal resolution. The only thing that we have to see is that we make, when the image is being made, that if the patient moves, that we still get the right information. So it still needs to be fast enough with regard to the motion. If we, for example, look at the functioning of the heart, what we will see then is that during some phases in the cardiac cycle, things are happening very fast. And in order to really look at the beating of the heart, we need, for example, 300 images per second in order to be able to really look at that in detail. Sorry, yeah. So now what's the difference with image quality? Because of course, resolution is one thing, but if you don't have contrast at the same time, we will come back in the way, between the things that you want to see, then you don't see it. So an image can be very blurred or can be unclear or cannot show what we want to have because of despite the fact that it might have a high temporal and spatial resolution. So image quality is a little more broader than that. Spatial resolution really is very much defined as saying it's like what is the smallest object that we can kind of discriminate using this imaging modality. As I said before, that's partially determined by the pixel size, but not only. That's what we know, for example, when you look at, for example, an Apple iPhone has much less pixels than many of the other ones, while some people say that still the resolution of the camera is better because of the fact that there's less noise or some other things. We'll come back to that later on. So image quality is something which is very broad. There's different aspects. So things like artifacts, for example, will also potentially decrease image quality. But all of these things will become much more clear when you see the examples. I mean, then you can see also when, for example, when we compare an image made with nuclear medicine versus an image made with magnetic resonance imaging, what you will see is that visually the quality of the nuclear medicine looks crap because it's very much smoothed. But on the other hand, it contains unique information that we cannot get in another way. So in that sense, it's like we really have to look at all these different aspects. But that is important, is that we really look at what is the best image that we can get. And also what you will see is like, what is very, very important is understanding how the images are made and what are the different aspects that determine the image quality. But for each of the modalities, we will look in much more detail.
Can I ask a question, please?
Of course.
I was asking because I understand the fact that you say that depending on the problem you have, you will combine different type of techniques in order to extract information you care about. But the thing is that we have been told in other courses that, for example, it is possible to convert mRNA images to computer tomography images because like they have like less information. So basically you can make some kind of reduction. So what I wanted to ask you is if there is some kind of hierarchy in the image modalities. So basically you have...
Yeah. The thing is, whoever told you that you can make one out of the other, that's just utter bullshit. That is not true. What is true though is that extracted information you can get from one to the other. So it could be that, for example, if you have a segmentation that you have from an MRI image, you can use that for a CT image. And you can also use deep learning, for example, to make something which looks like a CT image. But the thing is that none of these, as I said before, can actually exactly acquire what the other does acquire. So some things that you can acquire with CT, you really cannot acquire with MRI in the same way.
So, for example, if you use a resonance magnetic image and you get information about the physical reality with this magnetic resonance image, and then you have some software, a neural network, I don't know, that like basically simulates the acquisition of this information, you will not obtain like a computer tomography.
Theoretically, yes. Theoretically, that should be possible.
But technically not.
If you assume that your magnetic resonance can acquire all the properties that is needed. But that's actually not the case. Okay. As we will see, for example, I can quickly use it now as an answer, but it should become clearer later on. For example, what you will see is that CT or X-ray based imaging, what it does assess is actually atomic concentrations or atomic distributions. While when you look at MRI, what it does, it looks much more like to the molecular environment of hydrogen atoms. So this is something which is completely different. Although one will provide information on the other, it will always be at a different resolution, at a different contrast, at a different quality in some ways. So in that sense, it's like, if there was a hierarchy, then all the scanners in some ways would be the same. So then we just would have one scanner. And the other thing also, what you will see is that many people would say that magnetic resonance is superior, is the one that would be able to acquire everything. Now, the problem of magnetic resonance is that its spatial resolution is actually very low. Spatial resolution of magnetic resonance is much lower than many of the other ones, especially in a clinical setting. What you could, like if you have an ideal scanner and you could scan a person for 24 hours, for example, then with MRI, you could obtain much of this information. But as we will see, I mean, that is not possible in clinical reality. So at this moment, there is no hierarchy. What at this moment there is that each of the modalities provide their unique information and then are complementary indeed, depending on the clinical question that you ask.
Okay, thank you very much.
Yeah, we'll come back to that later on. A lot is also politics, as I said before. Is like what some people say is because it's a radiologist that has access to a magnetic resonance scanner or something like that. Then they obviously say like, look, my machine is the best. If you talk, yeah, exactly. And one thing that you should never ever forget also in medicine is the money effect. So it's very, very important sometimes, especially when you go to private clinics or something like that, is that somehow they have to get the money back and then they try to advertise something saying like, look, this is superior to that one, so pay a little bit more for this one so that I can pay my scanner. So these kind of things you really should always keep in mind. So that's why it's very, very important that you really understand what is behind all these things. It's like, which are the intrinsic qualities, and that's what we're going to try to focus on in this course. It's like, what is the basics of the machines, and what are the big drawbacks or the potential drawbacks. And then based on that, together with the practicalities, together with the financing, you can then decide what's the best way of kind of looking at a certain patient.
Thank you.
Now, another thing which is becoming more and more important, and especially also related to your question, is that actually the processing, image processing becomes more and more an enormously important thing. While originally in the past, the image that you would look at is exactly what you acquired. I mean, you just take the image and look at the photo in some ways. What you will see more and more is that the processing is like, how do you go from your raw acquired data to either the image or the quantification or the feature that you want to look at? Like, that becomes more and more important. We see it the same in the cameras, in the optical cameras. When you look now, as I was saying, for example, an iPhone, why might some people say that the images are better than from another one? Is because actually you're not looking at the pictures that the camera acquired, but what you're looking at is at the whole processing that is being involved with different acquisitions, different compensations, or whatever. And that's the final computed image in some ways, the processed image that you get. And this is what we also see more and more in medical imaging. At the one hand, we have the acquired raw data, and on the other hand, we have the features or the image which is presented, and there's a whole step in between. And nowadays, also with machine learning, you have this kind of algorithms to do fast reconstructions or sparse sampling and things like that. We're not going to go in very much detail in this course because we really want to understand the basics, but keep in mind that all of these things, again, it's very important to understand what they're doing and why they're doing it, because many of these things they will change the information content or provide you at a different level. So exactly as your question was, it's like, obviously you can use deep learning or simulators to go from one to the other, but you're always missing information that might be important. Now, one thing there also is like, let's come back a little bit to medicine in a partially philosophical way, which is very important here also, is that it's very easy to obtain or quantify or calculate somehow with minimal data and information of a normal person, because there you have a lot of statistics. But even there, normal is like, nobody is the same, and nobody is exactly the same. None of the anatomy is exactly the same. So even normal is a certain distribution. But what is very, very important in medicine is that you're able to recognize the outlier, because you need to look at the abnormality that is rare, that you don't see. So, and that is the problem of a lot of these techniques, which are based on this going from one to the other, is that actually the cost in medicine of missing an outlier is extremely high. The cost of missing an outlier in Google trying to interpret a face or looking at quantifying imaging, that cost is very low. But in medicine, that's very high. And that actually changes a lot in which are the algorithms and which are the approaches that we can use.
Because
and that's also, sorry?
There is no trade-off possible, because basically the risk of failing is too high that you cannot afford like to apply these techniques, I understand. And you need to really acquire
exactly.
data. I see.
Exactly. So many of these data augmentation things and things like that, it's like all of this is nice sometimes for training, but in clinical practice, many of these things will miss some information. And we're not talking about a machine learning course or something like that, but there are a lot of examples of this where, because of the fact that you don't have the training data, or because of the smoothing intrinsically related to this, or because of the kind of limitations of the conversions from one kind of space to another, you lose this information on this rare things. And that cost is extremely high. And that's one of the biggest problems when you go to clinical medicine. For research, of course, that's something different. And for some application, that's fine. But when you have to treat an individual patient, you have to make sure that you acquire the data that is relevant for that individual patient. And that's one of the big kind of bottlenecks or struggles at this moment to bring this type of techniques of simulations or machine learning into clinical practice. Because we can simulate, of course, physiology in some ways. But what you will see is that actually, again, we're not talking about a simulation class, but I mean, there's a lot of research, for example, in simulating heartbeats. But in my whole career, I have never seen a simulated heartbeat, so a completely computer-generated heartbeat that really looks like a normal heart when you look at imaging. And so we are not able to capture everything. And that's where it's very, very important that we still need to go back to this raw data of imaging, and then always combine this with the information that we have. So that's why processing has become very, very important. But on the other hand, it's crucial to understand where it comes from. And that's what we will try to do in this course. And that's why also, even when we would talk about the definition of an imaging modality, I think here is also already very important. Because a scanner, or whatever you want to call it, is a methodology that measures a physical parameter. So all of the scanners that we have, all of the modalities that we have, they measure something, and they measure a physical parameter. And each of them measures something different, and that's the most important. And what we assume, and this is the big assumption that is the most important to keep in mind, because that's the source of a lot of the problems, misinterpretations, or artifacts, is that this physical parameter that we measure, that we hope that is related to what we want to look at. So we hope to be able to measure something that is related to the anatomy, the metabolism, the function, the blood flow of the organs in the body. So here are two things which are important. One is the physical parameter. So we really have to understand the physics behind the measurement and what we are actually measuring. And the second thing is how we translate this into the kind of clinical or medical information that we want. And it's in this translation, actually, that this information is lost or gained, as we say. That's where the differences are. Because we look at different physical parameters, it actually provides a different view on these with a different resolution, a different quality, a different contrast, and things like that. So that's also why when you will look at an image, you have to keep in mind what you're looking at is you're looking at this information that is extracted from this physical parameter. Yeah? Because when we look at a photo taken by a camera, what we actually look at is we're looking at reflection of light. Yeah? But since we are so used to this, to looking at this reflection of light, what we say is in the camera, there's, for example, a face of this person, or there's a car or something like that. But in the end, we're looking at this reflection of light. For us, because we're so used to it, that's straightforward. But when we look at these medical imaging modalities, sometimes this relationship is not straightforward, and we have to learn this. We always have to come back to it. And so the interpretation of this, and this is also some of the things that will become super important, and actually when I ask questions in the exam, it's always related to this. It's like you have the image, you have a feature which is related to the anatomy, or to the function or whatever. Then we have to see is like, okay, how is this related? Why does something in a certain image of a certain organ look like this for a specific modality? And how is this related to this physical parameter? At this moment, it sounds a little bit abstract, but when you come back, when we have seen all the different imaging modalities, actually, this is the most important thing to remember in this course and to keep in mind when you try to interpret images. And here are some examples of these imaging modalities where you can see different things. So here, for example, this is a typical CT image, and this is a typical X-ray radiograph where you can clearly see already, here is like a clearly broken bone that you can see, but you see that some things are white, some things are black on here. Here also, this is actually a CT image, which is also a computed tomography image, which is also using X-rays, and now you can make slices, so tomographies through the body. And you can also already recognize some things anatomically. So you see here part of the spine, and that's white because it's bone. We come back to that, why that would be. You see here, for example, kidneys, there's a piece of liver, but what you also see, and this is the most important, in that some parts are white, some parts are gray, some parts are darker, some parts are black, and there's a very good reason why this is. So because black, for example, is because it's air. Air is not absorbing X-rays, so this is why it is. Here, for example, you see that the kidneys are much brighter than the liver or than the muscles, which is strange, which normally shouldn't be the case. And also what you see here is you see vessels. So these are like circular cross sections. And around the spine, you have the large vessels. And one of these vessels is also bright, which also shouldn't be the case. So this means that a contrast agent, for example, has been used. So these are the things that we will have to look at, that we have to try to understand. So, and besides looking at the anatomy, so by looking at the anatomy, or for example, here also you see that there's kind of things within the kidneys, very strange forms that shouldn't be there. So these are tumors. Somebody has a question? If you have a question, just start talking. Here, for example, this is a typical ultrasound image. So you see that it looks very, very different from a CT image, for example. And this is a cross-section to the heart. You see the 4 heart chambers and you see it moving. So one of the things is also that you can get dynamic images with a certain temporal resolution where you can look at the motion. Questions?
Excuse me, we can see the pointer, so we don't know where you are pointing at.
Really? Oh. Does anybody know how to enable that? You see it now? No. Okay. Okay, I'll try to say that way. So what I was saying is, so in the top right corner, that is an X-ray image of a broken bone. And then the middle top row, that was the computed tomography image that I was talking about. So with the spine in the middle, which is like bright, and then you see the two kidneys. But within the kidneys, for example, you see these kind of dark balls, like a little bit, which are in this case tumors. And also the fact that these kidneys are white compared to muscle, for example, while they're all soft tissues, and normally soft tissues would look the same. We come back to that later on. This already shows you that, for example, a contrast would be used. And in the top left row, you see that's an ultrasound image of the heart. So you see it moving. You see also that these images are very different, for example, in appearance. It looks a bit like a noisy image. So you see less of the organ boundaries in some ways, but you see the motion in this case. So functioning can be looking at the motion, but functioning can also be looking at, for example, two different conditions, and then see how it changes and whether that is what you expect. So when we look at the two bottom left images, these are kind of spines made by just X-ray radiographies. What you will see is a person that is stretched and then bending forward. And then we can measure, for example, the angles between the different vertebrae of the spine, and then see whether their mobility is normal, yes or no. So in some ways, although it's more like an anatomical modality, we still can look at functional information by doing a proper functional test. So that's also quite important. And then when we look at the bottom right image, that's a typical PET, positron emission tomography image, so from nuclear medicine. What you will see there is that the image quality looks like crappy because you don't see very much organs on there. But what you do see is you see these black organs. So you see on top the brain, which is black. And then you see in the middle of the body something which is also black. And that in some way shouldn't be there, because what nuclear medicine does is it looks at metabolism. In this case, it looks actually at glucose consumption by injecting radioactive glucose and see where it goes. And so you see it's very normal that the brain uses a lot of glucose. So as you know from biochemistry, the brain uses only glucose metabolism, while most of the other organs would preferably do fatty acid metabolism, because that's energetically more efficient. So you see here that here in the middle, there's a structure which uses a lot of glucose, and this actually is a tumor, because tumors would use abnormally much more glucose. So here again, while the images themselves don't look nice and the resolution is very bad, it provides unique information which you cannot with another imaging modality. So this shows you already how very different these type of images can be. Now, what is also important when we choose a different imaging modality, or when we choose how to process these images or what information we try to extract from it, is that we look at the purpose of this. So, because the purpose can be is that a patient comes to the clinic and you need to detect the abnormality. And you actually have to detect an abnormality in a patient that has come to you to the hospital for a specific reason. So that means that this patient has symptoms, something is wrong. So that means that you have to find something in some ways. So that means that the of being able to find something is extremely high. You just need to be able to find the cause. This is very, very, very different from, for example, when we do screening. Because, for example, screening for breast cancer is something that is being done. So women above a certain age are being asked to come to the CAP or to the hospital in order to get mammography, in order to see if there's potential cancer or not. Or it's also like colon cancer screening or some other type of screening. So this is, you have to detect disease in patients which are asymptomatic and which are unlikely to have disease. So here, what you need is a technique which can very sensitively detect if something is wrong. While in the other one, what you need to do is you need to find what is wrong, and you really have to look for it until something is wrong. So this is very, very different with regard to what is called the sensitivity and specificity. So when we need to make a diagnosis, you need to be very specific in some ways. It's like, okay, this is wrong, and this is the explanation for the problem. When we do screening, we need something very sensitive. That means that we should not miss any possible abnormality. We should not miss somebody that has breast cancer. Mostly at a cost that we will identify, or we find a lot more suspicious problems that then need to be investigated in more detail, but at least this is very important. So you really have to look at it differently depending on what is your pretest probability. And then, of course, the other thing is that what we also do is more and more with sophisticated therapies that we have, like device implantations or very complex surgery. What we do is we need imaging to see what's going on. So you have minimal invasive surgery now, where, for example, if you have cardiac surgery, we can actually currently work on valves that are leaking by just making very small holes and using endoscopes. In the past, what you needed to do is the whole kind of thorax of the patient had to be opened in order to have access. But this kind of minimal invasive can only be done if we have other ways than visually really looking at the heart while we're working on it. So we really need imaging and different imaging modalities that can in real time tell us what we're doing. So again, this is very different. So here, our imaging modality needs to be able to show us what we need to see in a very real-time way. In other ways, we have to detect something which is rare. In other ones, we have to detect something which is very different or might be subtly different in order to find explanation. So that means that all of these are very, very different requirements. And also, almost by definition, this would need different imaging modalities, because to get a real-time versus a high-resolution imaging technique, this is, for example, a contradiction which we currently mostly cannot solve technologically. So here again, not only is the information content that an imaging modality provides important for the choice, but what is also important is the purpose of it. Why do we do the imaging? And based on that, it could be that we need to choose a different imaging modality. So very quickly, I show you a couple of examples, and after that, we will do a break before we start talking about X-ray imaging. So here's an example of using imaging for intraoperative navigation. So this is, for example, brain surgery. That can be, for example, taking a biopsy of a tumor, or implanting like an electrical stimulation, or kind of doing a kind of tumor resection, as is shown here. So what you then have is like you can make high resolution images of the brain with the problems of the brain. Then the question is, okay, if it's something which is small, and also, for example, in the brain, when we do surgery, we should, of course, avoid touching healthy tissue and only kind of treat or cut away abnormal tissue. So we need to then kind of navigate through this imaging data set while we have the patient on the table. And so this is very important to do this. And what you also see is that what is very important, and something which is difficult, is that when you put the patient in the scanner and make the image, that's of course very different than when the patient is on the operating table. They have been trying to do scanners in the operation, but this is rare at this moment. A combination of cost, but also technology. So what we need is we need to find ways to match, to register these images, which can be done pre-treatment, during treatment. And here's an example of where like frames or markers are really attached to the head of the patient. And these are markers that we can see in the scanner and markers that we can see, for example, with cameras during treatment. So this is something which is an example. Here's another example of therapy planning. So where we use computer tomography images, so the raw images as we acquire it are shown in the top left corner. From that, we extract, in this case, the teeth and the jaw, because we're looking at dental implants, so like titanium screws, where so that teeth can be implanted on it. From that, we can then kind of do a virtual planning of where to put the screws, to say it's like, okay, which is the direction, which is the length of the screws, how do we avoid the nerve, for example. What you see is this yellow line on the middle image, this 3D image, that's the nerve. So of course, we should not touch the nerve with the screws, because that's going to be very, very painful, or we lose innervation, which is of course also not good. And then not only can we then plan how to do it, but then we can actually also, based on that planning, make, for example, guides for surgery. Yeah? So what you see in the top right is actually first a virtual and then a printed version of drill guides. Yeah? So we can then use this kind of guide, put it on the mouth of the patient, and then kind of make the drills for the screws as planned, with the exact angle and size and depth as was planned. So you see here again that images are, the raw images are not necessarily the information that you want, but it could be that we extract data from it that we then use in kind of virtual simulators, but also can translate into therapy. So all of these things are important. So it's very important then to know, of course, what the information content is and which potential artifacts are. So here is another quick example. So again, of therapy simulation. So this is therapy of a kind of a deformed skull, which is again a congenital disease. So this is a person born with abnormally formed bone, and so an abnormally formed skull. And so here also that the combination with other things is important. So from images, we can extract bone information at this moment. But then when we do surgery, of course, the idea of this surgery is to reconstruct a normal face. But the face is determined by the skin and by the fat and the muscle that is on top of the bone. And so we really need to do in these simulators, not only extract and simulate how to cut the bone, but see what is the influence on elastic tissues, for example, such as muscles and skin. So you see that it can become quite complex, but this is what the information that we can get, and then again augmented with information, for example, from simulation.